strutting.
I don't have to concentrate anymore on my head or nothing. It's natural. I've joined the world again, you know.
Ken,
Yes.
tell me a little bit about how you were before we started the 6-week program. What kind of symptoms you had? What were your weaknesses there?
Okay. Yeah, it was a challenge because I was losing ground. Last spring, I noticed that my stomach was starting to hollow out. My chest was kind of falling forward, and I didn't understand it because I was still doing my exercises. I was still doing my 2 walks a day. But I was leaning forward more. It was more painful to walk. I had to walk all the time with my hand on my side. That's when I got a hold of it, realizing, is this scoliosis getting worse, or what is happening with me right now? And so we finally got to meet up with you in September sometime, and then you did your diagnosis. You did and so at least at that point I knew where I was at, and then you had something for me that I could look forward to and try out, and you thought I would have some success with, and so I was on board.
Absolutely. So we decided to put you more on a strengthening and flexibility program for 6 weeks.
Absolutely.
Right. I wanted to leave you with the ability to have control over your own destiny.
Mm-hmm.
Being able to do exercises on your own.
Okay.
And not dependent on just coming in to see me all the time. Correct.
Correct.
And we want to see if we can make as permanent change as possible.
Absolutely.
Okay.
Absolutely.
How did you feel after for instance, the first week compared with the 3rd week, 6th week?
Well, it was to me it was a brick wall I had to go through. You told me you told me straight up that I had to be persevering it. I was going to have to deal with it. I had to get through it, and basically I did, because I started try walking without my hand on my side, and it was very painful, but I knew I had to do it. You said I had to persevere through it, and with the stretch program, I soon realized that because of the stretching that was involved, that I was able to hold my position, because it would stretch and allow me to hold my position rather than keep pulling me down all the time. So the stretching was very, very important to the part of the exercise program. And I could see right off the bat that there was excitement of it, because I could see I was gaining. It was very, very painful to get through. I had to walk through that pain thing, and then as I kept stretching, and I was more flexible, and then to try and correct my stature, I was able to correct it because my muscles were stretched out where it was allowing me to stretch to hold it, and it was painful. But as the program went on, the pain level kept going down.
Okay. If you were going to compare pre-program to the 6 weeks where we're at now, how much improvement have you had?
Oh, it's night and day. I'm walking vertically, and the dogs aren't laughing at me anymore. It's amazing. And it's on a good day when it's not. I mean, I have arthritis as such, and on the damp weather, well, okay, the pain is still there, but I'm able to walk down the sidewalk straight. I was interested walking there with my shadows to try to keep correcting my shoulder, correcting my stature, and I could feel improvement and see improvement week by week, and it was giving me an incentive to continue on.
Overall, from start to finish, would you recommend this program?
Well, absolutely.
Okay.
It's night and day for me.
Mm-hmm.
I'm back to life again. I'm back to where I used to walk 10 years ago. And it's only going to improve, because you're going to give me additional exercising. I'll be able to gain ground on my shoulder height, staying up. I'll be able to get my stride a little wider. I can get more movement in my arms, and pretty soon I'll have a flow to my walk.
Yeah, I think the 6 weeks gave you a solid foundation. Now we can really get to work.
Well, sounds good.
Okay.
Sounds good.
I want to see your walk outside. Come on with me. Let's do a final catwalk for you.
Okay.
Mm-hmm. I love how he's
I
strutting.
don't have to concentrate anymore on my head or nothing. It's natural. I've joined the world again, you know.
Awesome.
Life is good. It's great. I'm going back and forth here. I even know where I'm going.
And you're running too. Wow.
This is excellent. What a huge difference. If you see me there 6 weeks ago, you'd say, who is this?
His shoulder's a little bit dropped, shall we?
All right. Thanks, Ken. Appreciate it.
Okay.